Hello everybody, I'm Dr. Valeria Soltanik here at the office, and I'm going to touch the topic of dentures, the stages of fabrication, and the visits that the patient will usually need to do in a dental clinic, in a dental office. So a lot of you ask me, how soon can denture teeth, removable teeth be made? And usually it takes about 4 visits. So the first visit, when you're totally dentulous, when you don't have any teeth, first visit will be to take a mold, to fabricate a special mold, to take another mold on the next visit, which is going to be a detail mold, the second one. So we have first visit, an impression, a mold. Second visit, an impression with a special tray that was designed based on the first mold. And then the next visit will be a bite. And here we usually do the bite and trying at the same time because the laboratory is inside my clinic. So we take a bite, we do a trying with the teeth. We have to set them in wax. And then another visit to try all the teeth to make sure that the bite is correct, the dimension of the teeth that we chose are good, and the shade, so that everything is good on the biting part, and also that the patient is happy with them. So here I have one that we have to try very soon. This, you can see the texture is waxy, so it's still not processed. So this is ready for a try-in. So you see how the texture and everything is not like when you see my videos of the full dentures when they're very shiny and ready to use. Here you can even see the flaky wax. So because this, for example, if I leave it too long on the patient's mouth, it's going to start melting because it is wax, just like a candle will melt. This will melt with the warmth of the mouth. So these are ready for trying. Also, this is not the acrylic that's going to be delivered. Once everything is good, we have to flask it and process it. So inside that flask that you have seen some of my short videos with them, inside that all this wax is going to melt, and we need to pass another kind of wax, that acrylic, that's going to harden, and that's the one that's going to be shiny and used. So this is for a try-in purpose only. So these are full dentures, like I said, ready for try-in. And you can see this patient is totally dentulous, no teeth. But even though the patient doesn't have any teeth, we can still have a good and comfortable smile. In this case, we're not gonna use any implants, and the patient will be fully functional. So this is a try-in step. So correcting my saying that it was only 4 appointments, it's about 5 appointments for a full denture. Sometimes it might take a little longer in case we need to reset the teeth. For example, if the patient sees that the teeth are too much forward, we reposition them, we do another try-in until everything fits good. This really has to be custom made. You cannot go to a place and just get dentures. Oh, give me a pair of dentures. You just put them in and you walk away. They have to be custom made, okay? Also, since I have this model here, I'm gonna touch on a quick topic. Why a lot of the full dentures patients have problems and they move on the bottom. It's because this area here becomes very narrow. So when it becomes very narrow and flat, there's nowhere for this to to sit, so they start moving, and that's when we start adding some implants to get some retention. Sometimes 2 implants will do the job on the bottom with a denture on the top. I'm gonna have that on another video with another model that I can get on our lab. So those are full dentures, acrylic, and another type of partial dentures, removable teeth that you see a lot in my videos are the flexible, no metal partials, which I love because they're super aesthetic when the patient smiles, although they're missing, hello, they're missing some teeth, but not all. Usually in the past you had all those metal clasps that grab the teeth, and when you smile you see all that metal, and people know that you're wearing removable fake teeth. So nowadays, for many years, we have the flexible. This is ready to be delivered. It's a little flexible, you can see, because of the material, and it has instead of having the clasps in metal, they are the same material, the flexible material. So they're gonna grab around in the gum, and when you smile, you don't see them. Also, look, I don't know if it's easy to see in the camera, it has a little bit of a transparency, the clasp, okay? So when it sits on the patient's gums, what's gonna happen is it's going to mask even more. It's gonna kind of hide this clasp, so the effect is super natural. And you have seen in a lot of my short videos these when I put removable teeth, no metal, and these are these ones. And look, I want you to see how flexible, and they're very comfortable, flexible. They're not hard, so they're more comfortable. And once again, they grab around the teeth, the neck area on the gum, so they kind of go unnoticed, and people love it. This, I find, it's a very fast way of replacing multiple missing teeth. And here you see that the patient is missing the posteriors. I have the model here. So missing all these teeth here. So this is going to go on top, and it's going to replace all the back area, and it's going to restore the posterior bite. Look how on this person, with time, because it didn't have any teeth on the bottom, these teeth went down because they're looking for an opposing. Look, I don't know if you can see there how if you put a line here, you can see that they go down. Let's see if it's the same. Look here. Look, the collapse area here, like this tooth, for example, here, I mean, it's going to mimic the same here, but this person cannot eat or chew with the back. So very important now, it's gonna be very comfortable with this kind of partial. And like I was talking before, I went a little bit off track. These are more affordable than implants, yes. Do you need to do any surgery? No, unless you have to previously remove roots or any tooth. But these are affordable, few appointments, no anesthesia, no needles. So for those that cannot have implants or cannot have porcelain bridges, don't want any crowns, but they really want to replace their teeth, I think this is a good choice. Also, if you have these made, it doesn't mean that afterwards, if you want to upgrade to implants or do bridges, you can still do them, because these amazingly will maintain your bite. So you're not gonna get that because that person didn't use anything on the lower teeth. You're not gonna have the collapse of the opposing arches because you're missing teeth. So these are a little faster to do than a full denture. So just a couple of appointments, impression, bite, trying, and delivery. So for appointments, I have seen, depending on the number of teeth that the patient is missing, we can do 3 appointments. For example, that's what we do here. And yes, for whoever is thinking that if we can do that, just if I'm just missing, let's say 2 teeth on one side, can you do one of these? Yes, you can. It's gonna be a unilateral. It's gonna be like this, more or less. It's gonna have a little clasp on the other side, and it goes on the area. And I have done a lot of those for people that are really against touching any other teeth or implants, and they work amazingly. And the way you clean all the dentures are you remove them when it's time for you to brush your teeth. You brush your teeth, you floss, and you clean them with a special cleanser. And I always recommend the flexible ones. You either have to use those extremely soft brushes that are like silky, because you don't want to damage the material, and never use any abrasives that also are going to damage the dentures. So I hope I answered some of the questions that I constantly receive. I will continue reviewing them to answer the topics that you send me. It's a lot of topics, but I know I'm going to be able to answer all your questions. And if you have any consults that I could try to help, I will gladly answer them. You can send me the pictures, or you can videos to soltanikdentalvideo@gmail.com, and so I can go over the picture video and prepare something for you so that you can have my opinion. So thank you so much for watching my videos always. It's a pleasure to do them, to help you and to teach you and make you aware of anything that goes in our mouth, and that it's always connected to the whole body. Thank you so much. I'm Dr. Valeria Soltanik. Thank you. Bye-bye.